Coronaviruses attack the respiratory system, and this coronavirus causes a disease called COVID-19. Now, most cases are mild and similar to the flu or a cold. The symptoms can include a fever, coughing, and shortness of breath. They can appear 2 days or even 2 weeks after you are exposed.
In just over 2 months, more than 98,000 cases have been reported worldwide. The virus has killed more than 3,300 people, but more than 55,000 patients who had the virus have now recovered. The most severe cases have been in older people and patients with pre-existing medical conditions. Right now, scientists believe the virus spreads between people in close contact. That's within about 6 feet of one another. Public spaces are being sanitized in hopes of containing the virus. You can get it from an infected person's cough or sneeze, or possibly by touching something with the virus on it, like a door handle, and then touching your face.
The coronavirus has spread to 6 continents in just 3 months. It was first detected in December in Wuhan, China, where it had previously only been discovered in animals, but jumped to people. From there, the virus spread quickly, infecting dozens and forcing the Chinese government to publicly declare an outbreak. And that outbreak soon stretched across all of mainland China and then spread to neighboring countries, including Japan, Thailand, and South Korea. Across the Pacific, on that very same day, it appeared in Washington state. That is the first known case in the United States. By February 5th, the virus was on board the Diamond Princess cruise ship, docked at the time in Yokohama, Japan. Of the 3,700 passengers on board that ship, the virus infected 706 of them. Eventually, American passengers were brought home to military bases here in the U.S., and the virus, unfortunately, hitched a ride with at least 46 of them. Meanwhile, the virus landed in Iran. No clue as to how it got there. It also exploded in Italy. 124 cases became 888 cases. That is the largest outbreak to date outside of Asia. Germany, Britain, Croatia, France, and Spain have also reported cases all throughout Europe, and then also in the southern hemisphere. Brazil, Nigeria, Ecuador, and South Africa, cases there. All told, 89 countries worldwide are now reporting cases. And here in the United States, there are 21 states reporting at least one case of the coronavirus. And that leads us to today.
One of those states is New York. Meg Oliver is in one of the nation's busiest transportation hubs, New York City's Penn Station. Meg, the commuters there seem concerned.
Anthony, good morning. They tell me that they are definitely thinking about it, but as you can see, they're still going about their daily routine. I commute an hour a day by bus and subway, and I can tell you that I have seen more people using hand sanitizer. Here in Penn Station, more than 650,000 people pass through here every day. That's a lot of people in packed quarters as coronavirus fears spread. Cases doubled to 22 in New York State Thursday, and more than 2,700 people are being monitored. Now, nationwide, there are at least 230 confirmed cases of coronavirus, at least 12 deaths, 11 of those in Washington state. Now, those fears are creating a rush on hand sanitizers, masks, and cleaning supplies, sending sales up an estimated 817%. Store shelves are empty across the country. We went to a supply company in New Jersey where employees are working overtime to keep up with demand. The company's owner says it's hard to restock because many of the products are made in China. Cargo ships aren't the only ones being kept from our shores. Now, for all of these people traveling by rail, Amtrak tells us they are cleaning more trains and stations and using more disinfectant. Gail?
All right, Meg, thank you very much. Our Asia correspondent, Ramy Inocencio, has reported on this outbreak from across the region. First in January from the virus epicenter in Wuhan, China. Then from South Korea, that was in February. Now in March, he's in Japan. Ramy, Tokyo, let's talk about that first. It's usually a bustling city. What's it like now?
Gayle, good morning. I'm at the famous Shibuya Crossing. Think of it as Tokyo's version of Times Square, really one of the world's busiest intersections right behind me. Now, up to 2,500 people cross this thoroughfare every single time these lights change. And if you can believe it, this Friday night right here, this is actually relatively peaceful. Now, here in Japan, more than 300 people have been confirmed to have coronavirus. Unfortunately, at least 6 people have now died. But the interesting thing is that only about 900 people each day actually get tested for the virus. Now, that really truly pales in comparison to the country just west of us. That, of course, is South Korea, where about 10,000 people, that's right, 10,000 people get tested every single day there. So far, South Korea has more than 6,000 confirmed cases. That's the most for any country outside of China. But the death rate, get this, is relatively lower at only about 0.7%. Now, that could be thanks to innovative measures like drive-through testing. You heard that right, where medical workers decked out in protective clothing actually screen drivers who get to stay behind the wheels of their cars. Now, earlier, I spoke to Sharon Crawford. She's an American teacher in Daegu, where most of South Korea's infections are happening. She told me she actually feels safer there than the United States.
What can the U.S. learn from what's happening where you are?
I think transparency is a huge deal. I think being more prepared for potential outbreaks. I don't think America is prepared.
And Japan now says that starting this Monday, they are going to be quarantining any traveler coming from China or South Korea for the 14 days that they are still in this country. And of course, looking ahead to this summer, don't forget Tokyo is host of the Summer Olympics. That starts in July, just about 3.5 months from now. They say that preparations are still continuing, at least for now. Tony?
For now it is. Remy Inocencio in Tokyo for us. Remy, thank you very much. Italy was the first European country to ban flights from China, but that did not stop the virus from ballooning out of control there. Charlie D'Agata is in Rome for us, where the Italian government faces a massive challenge.
Okay, right away, let's get to those numbers overnight. The largest single-day increase since this outbreak began. There are now nearly 3,900 cases. 148 people have died. We're outside Italy's #1 hospital for infectious diseases, and you might just be able to make out those silver tents behind me. That's essentially a triage, and you see them outside hospitals, especially in the north, which has been hardest hit. And this is where people that may have the infection can be treated and looked after without spreading the virus to the rest of the hospital. Across the country, schools and universities have been closed. Italians had actually been urged to keep some distance from one another, which obviously doesn't come naturally in a country like this. This is also home to Europe's oldest population. The elderly have been advised to stay indoors for now. What you don't see out on the streets is a bunch of tourists. Across the globe, hotel cancellations are up to more than 70%, and Italy is at the top of that table. Gayle?
All right, Charlie D'Agata reporting from Rome. Thank you.